In the time we're about to spend together right now talking about traction and teams and startups, 2 people will die in the United States from diabetes-related disease. 1 person will lose a limb. 35 people will find out for the first time that they have diabetes, and 2 out of 3 of them will eventually die of a heart attack. What we hear from patients is, my doctor is great at telling me what to do, she's terrible at telling me how to do it. We need heroes to change the way health is delivered in this country. We need doctors that deliver expanded plans, caregivers connected with patients, and volunteers doing that great magic that they do. I'm Dave Vackel, CEO of LIGHTHOUSE, and we're in the business of making heroes and getting them paid. Our doctor heroes, we do it in partnership with the American Diabetes Association. They're our biggest investor. They review all of our patient and doctor-facing programs, have already roped us into some of their biggest corporate partnerships, and have got 150,000 rabid volunteers ready to become our greatest evangelists. Our doctor partners, our doctor heroes use our coordinated care platform, which integrates into every major EMR and connects to a patient-facing digital program that is somewhere between a digital boot camp in chronic disease and a graduate program in self-care. Combined with our passionate team of nurses, we qualify doctors for $500 per patient per year in Medicare incentives. Our nursing care team, almost all of them have got some other job. And for somewhere between 15 minutes and 3 hours a week, they log into our service, we connect them with people that need care, and they deliver that care, and we pay them. Spend 100 hours with us and take a little bit of training, and you're on your way to the first diabetes telecertification. If you're a passionate volunteer, we will give you a territory, materials, and a mission to help us advance. When the program began, we signed up a handful of doctors, 3,600 patients, access. We just finished our 3rd cycle of Medicare billing. Year 2 billings ought to be around $400K just for this group. Last week at the ADA Scientific Sessions, we announced a partnership with IBM Watson to solve diabetes. That's why our conference room looks like this for our welcome kits. We need heroes. Pull out your phone, text "Be a Hero" to 313131, and I'll find something for you to do to help the people, to help the loved ones that need our help. Thank you very much.
Hello again.
Yeah, I saw you yesterday.
I know. So I'm going to ask a question I didn't get to ask yesterday. So what do these doctors do? What's the methodology? Is there uniformity between all of these heroes doing the same process to affect some improved health outcome?
Yep. Our platform integrates into every major EMR. We lead them through the development of a digital care plan. The week after that, our nurses begin to call their patients and lead them through actively pursuing the goals of their care plan. What the physician does is enroll the patient and make sure that there's a digital care plan in place.
How do you address the environmental issues that are associated with diabetes? When I look at population health management, I look at a zip code people are in and the food desert that's there, so much of this is about managing, but there's little control locally. So what is different about this solution that's going to deal with some of those environmental issues?
What's great about our solution is that we're not trying to solve everything digitally. I think we believe that care at its best is delivered by individuals, and so our nursing team has great insight into the socioeconomic and full health set of the patients. We work with the Behavioral Diabetes Institute to how do you work with this group? We've also taken all of our content and voiced it over so that if your literacy rate is 3rd grade, your comprehension rate is still 10th or 11th grade, and you listen to our content. So we think about that all the time.
Thank you so much.
Text us, please.